Good evening. Thanks for choosing Twin States News. I'm Nick Smith. The state health officer is warning of the possibility of a crisis in the healthcare system if the COVID-19 cases in the intensive care unit continue to rise. Celeste Smith has more on the COVID-19 hospitalizations in the state.
State Health Officer Dr. Thomas Dobbs announced on Monday, July 20th, that 40% of the beds in intensive care units throughout the state are occupied by COVID-19 patients. Dr. Dobbs also stated that at this moment, hospitals within the state have placed elective surgeries on hold and are prioritizing care for critically ill patients as some hospitals begin to convert emergency rooms into intensive care unit beds. Also sharing that 9 hospitals within the state have no intensive care beds and that as of Monday, July 20th, there is 1 ICU bed in the Jackson metro area.
In a week or so, we would anticipate or maybe 2 weeks or so that we would exhaust our surge capacity within our healthcare system. And so we're looking at other options beyond that, but we may be at crisis standards of care within the next several weeks if we're not careful. And what does that mean? It means it's a little bit different healthcare system. It's putting people in open wards, it's doubling up rooms, it's housing people in places that they don't normally stay for medical care. We're looking at all contingencies right now as far as like what do we do when we get to that time point. But if we don't see a decrease in transmission immediately, then it's pretty likely that the healthcare system is going to be thoroughly overwhelmed.
The Mississippi State Department of Health continues to provide updates on the number of positive COVID-19 case numbers on its website and provides reports on the number of hospital beds used by COVID-19 patients. I'm Celeste Smith in Meridian.